You've got questions? She's got answers. It's Ask Nurse Lisa.
Hello, Nurse Lisa here with another edition of Ask Nurse Lisa. We have a viewer question today, and I'm really excited because this is a viewer question that affects all of us. So let's get right to it.
Okay. What hand is this coin in? That was easy. Which one? You got it. And my question is, what's all the talk about the teeth and the gums having to do with the heart? If you have some bad teeth and gum problems, that seems to have an effect on the heart. Is that for real, or is that just hearsay? What do you think?
Thank you so much for that question. Yes, good oral care is very important when it comes to other parts of your body, including your heart. How does this affect your heart? Well, most people understand that there's hardening and narrowing of arteries due to plaque and age, and they also know that sometimes blood clots happen and fill up the spaces left in the coronary artery, therefore causing a heart attack or damage to the cardiac tissue because it's not getting a good blood supply. Well, scientists over the years have figured out another reason why people get heart attacks, and it can occur with the things that we've already talked about, and that thing is inflammation. There's a lot of things that cause inflammation in the body, but one of those things is infection and foreign objects. Well, have you ever seen pink in the sink when you're brushing your teeth? Your teeth are living tissue connected to your circulatory system. So every time you have an issue of gingivitis and bleeding of the gums, you have a chance for infection to get into your bloodstream, cause things such as endocarditis, or even enough inflammation to cause a heart attack. Sounds serious? Well, yes, it is. But the good news is that good dental care is not as expensive as you might think. Dental care is one of the most simple ways to take care of your body. A toothbrush and toothpaste, floss, and things like that in regular dental visits do not cost anything compared to the cost of poor hygiene and tooth loss in later years. So what would you rather have? Pain at the dentist now, or being pretty careful about how you take care of your teeth? Remember, you don't have to brush your teeth, just the ones you want to keep. So what are the things that you can do besides going and seeing your dentist twice a year for x-rays and cleanings and a checkup? Change your toothbrush at least every 3 months, or when you get sick as well. Go ahead and change that out. Make sure you brush your teeth at least twice a day. In other words, you wake up and take care of them, and you always put them to bed clean. Flossing every day, because a lot of cavities and dental disease comes between the teeth. So it's very important to do that, and the more often you do that, it won't be a painful or difficult experience. Be careful about checking into what kind of toothpaste that you're buying. Spending just a little bit more on a toothpaste, I would recommend, because it certainly beats the thousands of dollars that you might be in for to either replace a tooth, remove a tooth. You were given your teeth for a reason, and they're shaped the way they are for a reason so that you can eat well and live well. So, if you have a question for me, send it in a file to AskNurseLisa@yahoo.com. That's AskNurseLisa@yahoo.com, because I love getting your viewer questions. They're some of my favorite Ask Nurse Lisa videos, and I'd love to answer your questions too. I really appreciate the support you've given me on this channel, and I look forward to seeing you next week.
Yo.